very good evening, all. I'm Aditi Lamba. This is Vision of Asia, our daily South Asian news segment, coming to you Monday to Thursday, 8 p.m. Eastern, and Sunday at 11 a.m. Eastern, only on ITV Gold. We are coming to you from New York City right now to present relevant, important, and thought-provoking information and news on coronavirus pandemic. Welcome to our special ongoing report focused fully on bringing forth information, updates, tips to get through this pandemic. Currently, coming to you from our New York City area, we again appeal to our audience to stay inside and keep practicing social distancing. It is essential at this time when cases are on an exponential rise in the United States and many other countries across the globe. Statistics through the day are showing more than 12,000 deaths in the nation and more than 370,000 cases. Walgreens and CVS pharmacies are now pledging to make it work with the administration on expanding diagnostic centers. Walgreens Boost Alliance is launching 15 drive-through testing sites for COVID-19 infections, and both CVS Health Corporation and Walgreens will be participating in launching more locations in efforts to do 3,000 tests per day across the sites. They're working now with the U.S. Department of Health and Human Services. Here's to hoping for an increase in testing in the country, a concern shared by many doctors as well as professionals on ITV Gold. Again, we urge you all to stay inside and stop the spread of coronavirus. Recently, the U.S. Surgeon General said that this week is predicted to be one of the worst for Americans, with deaths from coronavirus surpassing those of 9/11 and Pearl Harbor. So let's send a prayer out for the ones that have lost a loved one, and here's hoping for their strength. It's now time to begin the episode for tonight, coming again to you from New York City, packed with well-known medical leaders and South Asian frontliners. Here are the headlines. Dr. Ashish addresses South Asian Americans on coronavirus impact, Harvard Global Health Institute. Dr. Sudeep Chawla and Dr. Zorawar Singh on coronavirus updates and preventative measures. Cardiologist Dr. Raja Kulkarni on COVID-19 and heart diseases, American Heart Association, New Jersey. And lots on wearing a mask, need for PPE and other donations coming right after a short break. Stay with us in Vision of Asia, Voice of the Community. We'll be back shortly. Welcome again, I'm Aditi Lamba. This is Vision of Asia, special report on coronavirus impact, measures and advice. Our aim here is to bring forth South Asian leaders as well as professionals on ITV Gold, presenting the current ongoing statistics and strict call for social distancing. Recently, the Harvard Global Health Institute launched a regionalized capacity estimates, a closer look at hospital capacity in communities across the United States, which has revealed significant differences in the readiness for this pandemic. Director of Harvard Global Health Institute, Dr. Jha, said that their goal is to give hospitals and leaders and policymakers a clear sense of when they will hit capacity and a strategic information of how to prepare for these rising numbers of patients with COVID-19 needing care. We recently spoke with Dr. Ashish during a live interview on ITV Gold, expanding on the needs of the hospital, the peak of COVID-19 cases, and much more. Some startling facts here. Let's take a look at a segment from our live call with Dr. Ashish, Director for Harvard's Global Health Institute. Very important address for the South Asian population. Let's take a look.
But what I'm worried is that we're not using those 21 days to do all the right things. So you have to understand that the lockdown won't cure the society of the virus. The virus will still be there. It'll just bring the infection rate down.
Right.
The moment you let the lockdown go, the infection will come back. So the question is, why are you doing the lockdown and what are you trying to get out of it? And you want to do two things. You want to spread those infections out. But if you don't want to have to do another 21 or 28 day or 49 day lockdown 2 months from now, you need to use the current time wisely.
Right.
And the two most important things that India and Pakistan and all of South Asia needs to be doing is, one, substantially increase testing. You need to be testing large numbers of people. This is what South Korea did. And you need to be identifying people who are infected, and you need to be isolating them.
Right.
And second is you've got to be getting your healthcare system ready. PPEs for doctors. I know there have been a lot of complaints in India about the quality of the PPEs for doctors and nurses. Again, if doctors and nurses start getting sick, they just will stop coming to work. It's going to be a disaster. So both of those things are very, very important. And I want to make sure that the Indian government and the states are working on expanding those two issues. Otherwise, it's going to be a huge challenge.
Do you think India is currently ready, Dr. Jha? Do you think they are enough prepared with whatever measures they're taking right now, with the quarantine, with the vaccine trials they're also doing amongst themselves? Your take on, will India be able to combat cases as high as the United States if that happens?
Yeah, so I'm pretty worried that they will not, and that the number of cases in India will end up surpassing maybe any other country in the world. And while, again, I think the lockdown is a very good idea, very supportive of it, I don't see enough happening on how India will be able to open up and stay open. And it'll be very hard politically to do another lockdown. And you don't want to waste the lockdown. So you want to use this time wisely. And when I'm looking at the data coming out of India, talking to people who are in the leadership there, I don't think that the Indian government is using this time as aggressively, as effectively as it needs to be. And I'm very worried we're going to see a large increase in cases, maybe not in this summer, but certainly into the fall.
And in terms of just discussing a little bit more of that, we're looking at such troublesome numbers, doctor. We're looking at, us really not knowing what's going to happen next week. How do we truly hunker down? The entire problem is the fact that people are still outside. People are still not obeying social distancing. How do we really control the situation, especially when you're looking at huge countries such as India or the United States?
Yeah. So a couple of things. I mean, first of all, for people who are not doing social distancing, people who are still going out, still socializing, you have to understand that you're putting yourself at risk, you're putting all your family at risk, and all the work that everybody else is doing, staying at home, you're making it less effective. So it's incredibly selfish for people to be not social distancing right now, and they need to cut it out and they need to stay at home. That's message number one. Message number two is what I suspect will happen is when number of cases spike in communities where social distancing is not happening, governors will turn this into legal action where they'll have to enforce it with the police or even the National Guard.
Yes.
I don't want to get to that point where we're having to have police enforce, but that is where I suspect we may end up going, especially in communities where people are not taking it seriously. In India, of course, this is a huge challenge because we have large migrant populations. You have a police force that is not necessarily all that trusted to do these kinds of things.
Right.
So India is going to have a harder time enforcing social distancing, meaning it will be less effective, meaning that there will be more of a risk of a case, of serious disease outbreak. And that makes the testing issue even more serious, because I don't think social distancing is going to work as well in India for all the issues, all the reasons I have outlined.
So, Dr. Jha, in that case scenario, what do you require from our administration right now if we want to really, make the situation better next week, be better at just holding our hospitals to a capacity that they can treat patients? What are we calling at the administration for right now? According to you, where do we have to work? Is it local? Is it state? Is it federal level? According to you, where do we need to right now focus on?
Yeah, great question. So right now, there are two tasks, two jobs ahead of us. Job one is getting through the next 4 to 6 weeks. Job number two is preparing for the summer and fall.
Right.
So for the next 4 to 6 weeks, we have to be doing three things. We've got to keep everybody at home. There's still states that haven't fully implemented a stay-at-home order. It's crazy. Every state should be doing that.
Right.
And every community should be enforcing it. And if you know people who are not staying at home, you should call them up and tell them to go home. Second is, I know I've said this several times, our testing infrastructure in the U.S. is still not where it needs to be. Still too many people who can't get tests that they need. We need to ramp that up. And third is, right now, the federal government, all the state governments have to be focused like a laser on making sure there are enough ventilators, making sure there are enough preventive PPEs, personal protective equipment for doctors and nurses.
Right.
Because I am very, very worried that doctors and nurses are going to start getting sick in very high numbers, and you're going to have the whole healthcare system collapse because there are not enough doctors and nurses. That's what we need to do in the short run.
And continuing presenting top healthcare professionals and leaders, we now have a segment of our interview via Skype featuring top Indian American cardiologist from New Jersey, Dr. Rachana Kulkarni. She's also the president for the New Jersey chapter of the American Heart Association. According to the association, people with heart diseases or who have suffered stroke are advised to take caution, as according to the current information on American Heart Association, elderly with coronary heart diseases, hypertension, cholesterol are more likely to be infected due to the underlying diseases, and they develop more severe symptoms. Based on early reports, about 40% of the hospitalized COVID-19 patients had cardiovascular diseases. Addressing these statements and much more on cardiac issues surging in COVID-19, along with tips on hygienic practices, here is Dr. Rachana Kulkarni via Skype on ITV Gold. You are a cardiologist. You're also the president for the New Jersey chapter of American Heart Association. Have you seen a surge of cardiac relation with COVID? I know there are a bunch of new studies coming out which are saying that at high-risk patients who have heart diseases or who have other diseases, chronic conditions, may be susceptible more to COVID. How has your experience been hosting, both those kind of patients, if we can get some more perspective into it?
Of course. Aditi, people who have heart conditions, who have congestive heart failure, who have had heart attacks or compromise with high blood pressure, diabetes, heart conditions, specifically with congestive heart failure, they are considered high risk for heart disease. So they have to be extra careful, and that's why I say to the family, sometimes caring is not visiting your relatives with such conditions. They are definitely at high risk. If you see the example of Italy, most people who succumb to that disease, a majority of them were people over the age of 80. Oh, wow. And just because the propensity of heart condition is very high risk in these people. Definitely. Another interesting fact which has started surfacing now is, as you know, we initially thought that COVID is a disease of acute inflammation and acute respiratory syndrome in the lungs that makes the lung hugely inflamed, and there is this cytokine storm or surge which causes acute inflammation in the lungs. What we have started finding now is that inflammation affects the heart as well. And we have started seeing people who were discharged, who felt that they are getting better for COVID or were at least over the initial hump. And then they suddenly present with acute congestive heart failure like symptoms. And we think it's because of the myocardial, meaning heart muscle involvement with the acute inflammatory reaction with COVID. So we are going to see that more. And people, keep in mind, people who have already compromised cardiovascular system are more likely to feel the effect of that or will have detrimental effects. So we have to be very, very careful.
Doctor, South Asian Americans and South Asian community in general carries a really high risk of having these heart diseases. And I'm sure you must see many patients from our own community in the same regards. When we're looking at these patients that are on medication currently, that are in treatments right now, how should they look at COVID? We've actually had concerned patients ask us, what should they do since South Asians are such prime carriers of these heart diseases and chronic conditions? Your comment on that?
My two pieces of advice that I would like to share with our community is South Asians are at very high risk for having heart disease. So we have to be extra careful. Second thing is, please take your medications regularly. You're at high risk for having heart disease. Do not ignore Just because COVID is here upon us, heart disease doesn't go away. Every day we are treating patients still with heart attack and congestive heart failure and irregular heart rhythm. So that doesn't go away. Most of the doctors have fortunately switched over now to telehealth.
Yes.
So please follow up. Please take your medications regularly. And if your physician is offering telehealth, if your physician is offering, please have your follow ups. Please make sure you keep up with your medications and your appointments to minimize your risk for COVID and increase your chances of surviving it. COVID is a virus.
Right.
And as we know, there is no definite treatment for a virus yet. However, there are simple measures that we can do. Some drugs, such as hydroxychloroquine and possibly azithromycin, have been shown to have some beneficial effects.
Right.
But we in medical profession know that what really works is a vaccine, which is probably some ways to go.
Yes.
So we cannot rely at this point just on medications. We have to see what we can do to destroy the virus. And it's fairly straightforward, actually, when we look at that, washing our hands
Yes.
with soap and water, because the virus has a lipid cover on it. And if the lipid cover gets destroyed, the virus is unable to propagate. So, hence, washing our hands strictly, at least for 20 seconds, with soap and water can disable or can destroy that lipid coat. So, that's very important, and I cannot overemphasize the importance of that. So, wash your face, wash your hands, and wash in between your thumbs, because this is where this is an area that can get overlooked. Another very important thing is stay away from jewelry. Rings, if you have to have your wedding band, wear your wedding band, but no other jewelry. Also, try not to have earrings, anything in the neck, just because those can be places where we don't touch, we don't clean, and viruses can stay. So that's another simple thing. It's a virus that propagates with droplet transmission.
Right.
So keeping safe distance, 6 feet between us, and social distancing is very, very important.
It's time for another short break on Vision of Asia, Voice of the Community. Come right back. Welcome back. This is Vision of Asia Coronavirus Pandemic Special Report, and I am Aditi Lamba. We continue to present to our viewers more on the impact of COVID-19, measures, updates, and insights. As we are filming this episode, number of deaths in New York has now crossed over 5,000, with over 140,000 cases across just the state of New York. It's increasing in numbers across the entire country. Today, U.S. Secretary of State Mike Pompeo announced an additional $225 million in U.S. aid for global efforts in fight against the pandemic, but with a focus on keeping critical medical supplies and PPE in the country. Lack of PPE and other supplies, including reaching hospital beds and ventilators, have now become a major concern for healthcare and medical workers across the board. With the medical community again urging all to stay inside and practice social distancing so that the critically ill could be taken care of, here is another virtual conversation with leading chiropractor Dr. Sudeep Chawla and Dr. Zorawar Singh with his expertise in internal medicine. Both the doctors joined us virtually discussing information on COVID-19, immunity building, and current measures. Here is the story.
I want to reflect a little bit more here on patient care. This entire scenario of COVID in the last 2 months has completely changed how healthcare system is running, how patients are being taken care of, who gets taken care of. I would like for you to comment on the impact of COVID in just normal patient taking care. Your normal patients, your stroke patients, your heart patients, just your normal patients that you have in your chiropractic service as well. And how I know you have to take a lot of precautions just treating other patients that are non-COVID, but what does that do to a system when this continues for a month or 2 or 3 at this rate?
Yeah, I mean, it puts an impact on the entire hospital system as a whole, because it's limiting all our resources. You know, all our elective procedures have been declining as a whole. You know, elective surgeries, elective colonoscopies, or even screening procedures such as outpatient exams, mammograms, all these things for women. Things are decreasing by the numbers, and that overall, just being able to screen patients is impacting the general population. In terms of normal care, like I said, I have to wear personal protective equipment for all my patients now, because once I'm in contact with one patient who's positive for COVID-19, if that patient coughs or sneezes while I'm in the room, that virus can be on my clothes, and be on my gown and all that stuff. So it's best that I keep myself protected and keep my hands clean, because I go from patient to patient, seeing 20, 30 patients a day. I want to prevent spread to someone who's asymptomatic.
Right.
Yeah, it all comes, we talk about awareness. Once again, it's patient awareness, following guidelines of the CDC. The media is actually doing a great job as far as what to do, even if though you're, asymptomatic, social distancing, so on and so forth. Whereas Dr. Singh kind of works, front line with these patients that are more acutely affected by this. My job more as a chiropractor is I'm looking more as far as preventative measures.
Right.
So I try to educate my patients on what to do preventive. And, one of the philosophies as far as chiropractic is concerned are two things. Number one, your body has the capability of healing itself. It can only heal itself, though, if it's running at optimal, health speed. So when I break it down, I kind of say that any sort of disease, any sort of malfunction within the body, there's three different factors that are involved. I look at an emotional aspect, I look at a chemical aspect, and I look at a physical aspect. And, there are different recommendations on making sure the emotional, chemical, and physical parts are at optimal, health. Because if those three are at optimal, the body will help, fight against contracting this disease.
Right. Discussing this disease a little bit more, I want to talk to both of you. Right now, there's so much going on in the news about the new vaccinations that they're working on. They're hoping to, have something out by the month of September, as we keep on hearing. There is that anti-malarial drug with azithromycin that we keep on hearing are some of the ones that FDA is approved for trials. Obviously, some people are saying that, a lesser case of COVID or, could be solved just like a flu. I would like to just sort of open this floor up for, facts that we can learn today. As of this week, what's happening in terms of these treatments that are available, and what do you both hope, they're able to establish through these treatments and processes, and how long do we have to live like this? Some tough questions there.
Yeah, I think that the drugs you're talking about, hydroxychloroquine or Plaquenil, which is an anti-malarial drug, is being studied right now. I don't think that there are actual clinical data. It's a little too early to say that if this drug is going to be beneficial for us or not. But people have to realize that this drug also has its own side effects. People who have, pre-existing cardiac conditions, prolonged QT intervals, people who have muscle pain, neuropathy, this drug can worsen that. And right now we're trying to use this medication sparingly, just for patients who are critically ill in the hospital, and seeing if it'll provide any benefit. I wouldn't give this medication to a patient who is feeling okay but is positive for COVID-19. Just for our Indian community, we'd like to see that let's try this medication and let's see if we'll get better. But I really want to stress that this medication is really being reserved for those patients who are actually very critically ill on ventilators in the ICU, and seeing if it provides any benefit. And in terms of your comment on immunizations, I know that they're thinking of working till getting this out until September, but we're now just starting to have patients seeing if they can donate plasma and seeing if we can get an immunization made for this medication, for this disease, But I think it's still going to be a little while before that happens. Last night I was watching on the news. It looks like from the CDC we're hearing maybe possibly up to a year where we can start seeing an immunization. But going forward,
you're talking about the
I'm
antibodies.
sorry.
There are these antibodies that are talking about in the news. You're referring to.
Correct, yeah. And I think that it's going to be, going forward that I think they will make a vaccine for this, and I think it'll stick around. You will get a flu shot, and you might even see people getting coronavirus vaccines too.
Wow.
Yeah, I would say there are three things that kind of make this COVID-19 scary right now. And you guys kind of touched on most of those points, but just to break down again, those three things is number one, there's no vaccine right now. And even when a vaccine is created, they have to be tested through randomized controlled studies. These are words that come out of Dr. Fauci's mouth himself, that they have to go through these randomized controlled studies before they can be set out into the public. And then the second thing is that we've never seen anything like this before as far as COVID-19 is concerned. So therefore, you touched upon antibodies. Well, your body will eventually create those antibodies. Like I said, your body has that power within itself to heal itself. So your body, when it recognizes this COVID-19, eventually it will create those antibodies. But since this is kind of the first time we're really seeing this as a pandemic like this, it's going to take time for those antibodies to really kick in. And then the third factor is right now we don't have a true control on it. It's not about, hey, this is a cure, this is how we're going to treat it. Everything at this point is all about preventative measures, and we have to practice those. Otherwise, this is just going to continue to grow. From what I've read, I would say 10 or 20% of people maybe have it right now. What's going to happen is once this whole quarantine's over, people are going to want to go out. Hey, I'm going to go travel. I'm going to go do all this fun stuff again, realizing that there's still infected people out there again. Now, this is just my personal opinion, but I feel there's going to be a second wave of this again because of that. And until I would say 70 or 80% of the people go through this cycle, we're going to have to deal with this whole cycle ourselves as far as social distancing is concerned.
You just brought up a really excellent point. I had the honor of interviewing the director for Harvard's Global Health Institute, Dr. Ashish. He's a very prominent doctor. He's working very closely with all the research that's happening. And he said that there would be a second wave of coronavirus. Not only a second, he's anticipating a third wave. And he sees this going for about 12 to 18 months. So, he basically sent us a very alarming message that we need to take this very seriously. This brings me to the fact that, right now we are talking about April 15th, which is supposed to be the peak, of this coronavirus right now, especially in the Northeast as we're all located in. This week, they're saying it's supposed to be the saddest week, as we're saying, in the United States, just due to the amount of deaths that have happened here. It surpassed 9/11. It surpassed Pearl Harbor. Could you both reflect on to what is exactly going to happen at this peak? And suppose we reach this peak, April 15th, what am I looking at right after that? Like, what happens right after that? I think right now we're just preparing for this peak and the highest numbers of cases and deaths, but what after?
Yeah, I think after we have to continue to keep, pushing on with social distancing. I think just because the disease has peaked makes people feel comfortable, like, okay, we've hit the worst and we can relax measures a little bit. No, I don't think that's the case. I think, as the Harvard director was mentioning, that there might be a second or third wave, as Dr. Chawla also mentioned, that could very well be a possibility because there are people who are still sick from this virus or who don't have any symptoms. So if we start to relax measures a little bit, the wave can come back again. I think moving forward, I think once we have seen that incidents of diseases are decreasing and deaths are going down. I know in New York yesterday there was a decline in number of deaths as of the last week. I think people still have to continue to have social distancing and still isolate themselves as best as they can, continue to use face masks, where they can continue to wash their hands. This disease is never going to end. Like the influenza never ends. Every year we all recommend everybody get a flu shot. Everybody go and get, if you're sick, stay away from family. Try not to infect anyone.
Right.
I think moving on, where this is going to be a new social norm, that coronavirus is also a virus that can make everyone sick.
Right. And Dr. Shabbat, quick question before you answer that. Do you think nutrition and building immunity is going to be a huge part of this?
Absolutely. And that's something I do want to, touch up on. As I told you, with our philosophy in chiropractic, the three things we look at is, an emotional, a chemical, and a physical aspect. So I'm going to give recommendations, pretty much on what you can do to build up immunity. As far as emotional is concerned, a lot of people I know they're missing their friends. The social distancing is really bothering them, but they have to keep their stress down. The more you are stressed, the more your immunity is going to continue to go down. So keep yourself busy with activities at home. One thing is like yoga, meditation. It's very important on the emotional aspect. We really take care of ourselves. Secondly, we have to realize online there's so many counselors that are out there. Take advantage of that. If you really feel you're really down, you're mentally going to go down, but you got to realize your immune system is going to go down at the same time. So if you need help, yoga, meditation, online counseling. Then if I look at like a chemical component, we have to look at our diet. We got to make sure we enrich ourselves, especially they've mentioned vitamin C's and vitamin D. Overall, make sure you're eating correct. If you're not eating correct, that can bring your immune system down as well. Just because we're in the social distancing moment right now doesn't mean you can't really go outside. Get some sunshine. It's the one way to get vitamin D in your system is go out, get some sunshine. It is recommended to do it between 8 a.m. and 11 a.m. That's when your body really absorbs and converts for vitamin D. Anything after that, they say it's actually more harmful because of the UV rays. So between 8 a.m. and 11 a.m., try to get maybe 20 to 30 minutes of sunshine at that point. And then as far as physical components are concerned, stay active. You want to make sure you're exercising. And secondly, sleep. Make sure you're getting plenty of rest. If you're getting plenty of rest, your immune system's going to grow, your body's able to regenerate. So those are some of the recommendations I have.
And this wraps up our show for the night. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com, or you can follow us on Facebook @itvgold. Remember, you can also now subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us this evening. I am Aditi Lamba, signing off here. Take care and be well.